It's my honor and pleasure to introduce a guest, a very good friend of mine, and a very special individual, Professor Steinberg. Professor Steinberg has, to try to describe his roles and his jobs, it'll take too much time. He's a unique individual that really has so many positions and does so many roles that each one of them is more than a full-time job. He's a prominent neurologist, and he heads a medical ethics unit of Shaare Zedek Hospital. He leads the editorship. He's the main editor of Encyclopedia Talmudis, which is the background behind which he's sitting, or which is behind him, so to speak. And during the whole COVID saga, when it started back in February or March, he was the main address to be a liaison between the Ministry of Health and the rabbinate. There were so many questions about every aspect of our religious existence, which seemingly was conflicted with COVID, and so many difficult situations were created to do with circumcisions and burials and weddings and other, and also halachic positions in hospitals, triaging, and many other factors which became an issue during COVID. And he was always the main liaison people look up to, both from the secular Ministry of Health and trusted by the rabbinate to make the right decisions, the right positions, and published already a number of works connected with the halachic ethics, with pandemics and COVID. And but he has a special connection with us here in Sydney. He's been a number of times to visit us, and specifically to assist us to start a halachically acceptable protocol to allow members of the community to be organ donors, which I'm giving already a little bit of the question that is asked in this lecture. The question is, can a religious Jew be a donor? The fact that he came to assist us to create a protocol shows that it's possible. But today we'll discuss. I'll be more than happy to give the bulk of the talk to him. It's a very rare opportunity to have him talk to us. I might interject to ask some questions. But firstly, we mentioned in our last lecture the conflict among halachic decisors, among halachic authorities, about the moment of death between the cardiac and the brain. Whether or not it's the heart which decides when a person is there, with the death of the heart, or the cessation of any breathing activity, which may be controlled by the brain. So how would this apply, Professor Steinberg, to the question of organ donations? Why is it so crucial in order to be able to decide whether it's possible at all to be a donor?
First of all, thank you, Rabbi Ulman, for inviting me to be a guest in this wonderful series of lectures that you are conducting. It's really a great honor for me, and our friendship, as you mentioned, goes far back, both in Sydney and in Jerusalem, and corresponding, and Baruch Hashem, our relations are wonderful, both on a personal and on a halachic level, and I really appreciate greatly the opportunity. In order to understand why this is crucial, the question you posed, whether a person is defined halachically for our purpose, but also ethically and legally in many different countries, whether the person is dead when his heart stops, or whether a person is dead when his brain dies, or whether a person is dead when he can't breathe anymore. And they are connected, but they are also not connected. And let me explain just the fundamentals from a medical point of view. the easiest way to say that a person is dead is to wait for each and every organ and cell in the body that dies. And then biologically, this person is dead. This, however, in the 18th century, there were some countries that actually enacted such a law because physicians made mistakes in assessing the death by cardiorespiratory criteria. But currently, no country in the world is waiting until each and every cell and each and every organ dies. The person is pronounced dead much earlier than this determination. The reason being that the death of the organism is not necessarily the death of each and every cell. And halachically, we certainly accept it. And just for your knowledge, if someone is diagnosed dead, whether by heart criteria or by brain criteria, which we'll explain in a minute, and he's being buried, while he is engraved, there are still live parts of his body. And that is irrelevant for the definition. It's too extensive to go into the philosophical argument why, but this is accepted by everyone, including according to Allah. So what we are looking for is which function or which organ is the one that if it stops irreversibly, the entire person is regarded dead, although some parts of it are still alive. So the classic definition was a cardiorespiratory death, combining two signs. One is that the heart is not functioning anymore, and the other one that he is not breathing anymore. In the old days, the difference in time between these two signs would be a matter of minutes. If the heart stops, within very short minutes, the breathing will stop, and if the breathing stops, within a short period of time, the heart would stop. What happened 70, 80 years ago was the invention of a respirator. And what happens with a respirator is that if a person stops breathing because his brain is not controlling the breathing anymore, and therefore it's impossible naturally to continue to breathe, we can put such a person on a respirator, and then the heart will continue to function because the heart doesn't care why and where he gets the oxygen and the fluids and the blood pressure and so on, whether it's through a machine or through the brain. And therefore the heart can go on for days and sometimes even longer after the brain totally stops functioning and the respiration is totally dependent on the brain, and therefore there would be no respiration. That created a new question, both legally, ethically, and especially from our purposes, halachically. Now that we separated the two classic signs, the heart function and the respiration, into hours, days, and sometimes even longer, when will this person be regarded as dead? Is it only after the heart will stop in a few days, or is it already when the respiration stopped because the brain died? You could argue, who cares? Let's wait another few days and the heart will stop, and then we'll come back to the classic definition. However, there are two major issues in modern medicine. One is such a patient who is on a respirator is necessarily kept in an intensive care unit. Intensive care units are very limited in the beds they have in any hospital all over the world. And if the person indeed is dead because he's not breathing anymore, because this is the determining sign, and we are keeping him in this bed for another 3, 4, 5 days, during this time, we may lose a patient's life who is in need of the bed but can't get to the bed, and he will die, although if he would get the bed, he'll survive. So keeping someone who might be dead, if we define it by respiratory death, and we are just keeping him to be on the safe side and wait till the heart stops, that may cost the life of others. And perhaps even more important, now that we know how to transplant organs, and actually we can take any organ from one dead person, sometimes from live people as well, but now we're talking about dead people, any organ except for the brain that is not done and rightfully so, we can save many lives by obtaining functioning organs from a person, provided we define him dead. So if we can define him, if it's halachically acceptable, that once he stops breathing totally and irreversibly because his brain died, and the heart is still functioning, therefore all other organs are still vital, he is defined dead if we accept it, and therefore we can take the organs that are vital to so many other people. We can save 7, 8 lives by just one donor. On the other hand, if we'll say just to be on the safe side, we'll wait till the heart will stop, after the heart stops, there are hardly any vital organs that can be used in order to transplant. So the important point, I think, is to understand that we are not redefining the moment of death in order to gain something that we want to gain. The definition has to be irrespectful, unrelated to the outcome. Is it true or not true? But once it is true, then we can gain so much out of this decision.
Thank you very much. I just want to, before we continue, I want to say that Professor Steinberg authored a number of monumental books in the field of Halacha and ethics and Halacha. The most famous one, the oldest one, was this one, which was translated into English. It was originally in Hebrew. It's called the Encyclopedia of Jewish Medical Ethics, a number of volumes. And the latest one, which came out just maybe a year or two ago, was a multi-volume called Harefua Kehalacha, which means medicine in Halacha, which goes from before birth until after death. Basically, going through every aspect of our lives in the eyes of medicine and Halacha. And a large part of it obviously is dedicated to this topic. Now, once the topic you made is the point you made is a very important point. We cannot, we spoke last week that life is holy no matter how old the person is and how healthy or sick he is. And it's forbidden to kill a 95-year-old person or 105-year-old person in order to save a 5-year-old child, because it's not up to us to say which life is more important and to take one life to save another life. And therefore, to be able to fit the criteria of death, depending on the fact that we want to be able to use it to take organs from a critically ill patient or a dying patient to help another one, that's unethical and it's against Halacha. So there are two main positions in Jewish, among Jewish Halachic disciples. And as you said very correctly, that it wasn't discussed openly until a few years ago, only in the last decades, because until now, it was irrelevant to discuss whether it's the heart criteria or the brain criteria or the breathing criteria, because all they did was they put a feather to the nose of a person to see if he's breathing or not. And if there was no movement on the feather, it meant that he was irreversibly, he's dead and you can't bring him back to life. And therefore he could be buried already. He was, by definition, he wasn't alive anymore. But today it became very relevant. So if you could explain a little further to us, first of all, what is the, at least in a very general way, what are the halachic sources behind both arguments? Because we know that the scenario is a very recent scenario, but everything that we decide in halacha has to be based on Talmud and the codes, which were codified 2,000 years ago. So where are the arguments in the Talmud for the heart criteria and for the brain criteria? And on the practical level, how can we use those criteria in order to be able to make a decision whether that we are able to become donors, whether it's permissible in halacha to become donors, or whether it's not permissible. Now, again, we are talking over here not about donating a kidney or donating a piece of skin that you could give when you're alive. We're talking about being a donor after death, because there's certain organs such as heart and liver that you can only give once you passed away. A person can survive with one kidney, with one ovary, for example, but a person can't survive without a heart or without a liver. So we have to define what we're talking about. So can you tell us a little bit about the sources behind it and how it became discussed in modern terminology relating to this particular topic? I want to say that Professor Steinberg, because of his unique position as being one of the principal ethicists of halacha, being a doctor, a Talmudic scholar, Halachic scholar, and being an expert in Jewish medical ethics, he had an open door to all of the great authorities in Israel, and primarily one of the greatest authorities of the 20th century, Rabbi Shlomo Zalman Auerbach, who passed away in 1995 in Jerusalem. And we'll talk a little bit later on. I'll ask about a specific experiment that you made, but let's just talk about this question.
Okay. Just to preface before I give, there indeed are several sources that are relevant already from Talmudic times, stated in the Talmud, but there is a difference between what the secular world calls heart criteria versus brain criteria, and what we in Halacha discuss, heart criteria and respiration. Now, it seems like it's one and the same, because any definition of death obviously has to be irreversible. If, let's say, we say that respiration, cessation of respiration is the moment of death. If I'll do the following, I wasn't breathing now. Would I be called dead? Obviously not. Why not? Because after a minute, I resume breathing. So if we say that someone is dead by respiratory criteria, it means that not only isn't he breathing, but we have to verify that it is irreversible. He will never go back to breathe. And the same is with the heart. If someone's heart stops and you do resuscitation on him, you do CPR, and the heart comes back to function, we don't say that he died and now we revived him and he's a new person, and maybe his wife was for a moment an almona and now you have to remarry her because you came back. Obviously, he was never dead because it was never irreversible. So the prerequisite is that we're talking about an irreversible situation. Now, breathing is totally controlled by the brainstem of the brain, this part of the brain that the breathing center is located, and that makes us breathing. If this center is destroyed, there will never be a spontaneous breathing in this person. Now, the brain death criteria looks at the brain as the important organ that if it dies, then the person is regarded as dead. In Halacha, we actually regard the breathing as the important aspect of life. As it says in Genesis, when HaKadosh Baruch Hu created Adam, he put in his nose the power of breathing. That was his birth. And at the Mabul, it says that everyone died, and the language used was that everyone who is breathing wasn't breathing anymore. So the breathing is what is the function that we look for if it's irreversible. But in order to be sure that it's irreversible, we need the criteria of the brainstem destruction. So now there is an interesting paragraph in the Talmud discussing a situation where a building collapsed on Shabbat, and we know that there is a person under the debris. So according to the rule that even a great doubt whether a person is still alive and we still can save his life, we are allowed to desecrate Shabbat in order to save the person. So hence, if we see such a collapsed building and we know there was a person under the debris, we are allowed to desecrate Shabbat in order to get to the person. And if we get to him and he's alive, we can save him. Now, the situation is that we desecrated Shabbat, we took out all the debris, and we got to the person. Now, the rule is that we are allowed to continue to desecrate Shabbat only for a live person in order to save his life. But we are not allowed to desecrate Shabbat for a dead person because there will be no use of this desecration. We can't bring him back to life. So the Talmud asks, once you got to the body, how do you know if he's still alive? What do you do in order to find out if he's alive or not? And there are two opinions. One opinion says that you check his heart, and another opinion says that you check his nostril. Obviously, the one who says you check his nostrils is not to see if he has a nose. That has nothing to do with the question if he is alive or not. But you do what Rabbi Ulman said a few minutes ago. You see if there is breathing coming out of his nostrils, let's say by a feather or by any other means. So we see already in the Talmud, when in very extraordinary circumstances, the question, which sign is more important? Is it the heart or is it the breathing through the nose? What determines whether he is alive or not? And that was, in those days, the only situation, such unusual circumstances, but the principle is the same. Now we don't need a collapsed building in order to ask, how do you determine if the person is alive or dead? Now you put him on a respirator and you know that he's not breathing on his own at all, it's just artificial, but his heart is functioning. Is he alive or dead? So that is the main source, which the opposing views amongst the rabbinic decisors all use this source to see what conclusions we can derive. The simplest way to understand it is according to the ruling in this particular case. Every dispute in the Talmud has its resolution in later generations by the Rishonim, by the early decisors, and they decide which of the opinions is the leading ruling opinion. And all of them, all the Rishonim, without exception, rule according to the nostril, meaning that if you see that the person under the debris is not breathing, you don't have to check for his heart. Even if his heart would still function, as it appears from this example, he would be regarded dead, so that we will not continue to desecrate Shabbat for him because he's already dead. So if we take this paragraph in the Talmud and this interpretation of the Rishonim and their ruling, so coming back to our situation, if we have a person that on the one hand his heart is functioning, on the other hand he is not breathing on his own, and that is possible today because of a respirator, we can determine that he is dead based on the respiratory criteria and based on the fact that we have to check that his brain is totally destroyed so that we can verify that it is an irreversible process. That is how the Chief Rabbinate of Israel decided, and many important decisors ruled, even in our days, coming out from this particular paragraph. The opposing view that says that just cessation of respiration, even if it's irreversible because we can prove that the brain was destroyed, is still not sufficient. And if we know that the heart is functioning, we still are dependent on the heart as well. And according to this opinion, that particular person is not yet dead and has to be on the respirator until his heart will stop. This difference of opinion goes on and depends on how you stand. my personal view, speaking to all the decisors on both sides, and obviously it's irrelevant what I think, but just to be open, I did understand and accept the opinion that it goes by respiration and by irreversible respiration, and therefore, if we can diagnose someone that he is not breathing and his brain, especially his brainstem, is totally destroyed, so he will never breathe again, he is dead. If he is dead, he can become an organ donor because the functioning of the organs that are still alive are irrelevant to the definition of the individual's death.
Yeah, even though Jewish law is not political, it's based on scholarship and sources, but inevitably what happens is, probably in other times also, but especially in our times, many questions become politicized, and the perception becomes that a particular halachic opinion is based on the on a level of piety, or on a particular level, a particular label of the rabbi, and so on and so forth. So there is a certain misconception that developed for sure in Australia, but also in America, and I'm sure in Eretz Yisrael, also in Israel too, that the more Haredi, what they call the ultra-Orthodox opinion, is the hard definition, and the more modern, so to speak, is the brain definition. The reality is that true scholars never thought in that direction. The only thing which motivated them was the sources. I mean, I must say that over here, myself and my colleague in Sydney, even though ultimately when we created together with Professor Steinberg, when we created a protocol to allow for Jewish people and religious people to be organ donors, we still gave the respect to each person to have his own rabbi, and if his rabbi tells him to follow the hard criteria, that's his prerogative. However, I also felt much more foundation in the respiratory definition, in the breathing definition. It seems to me from all of the biblical and post-biblical sources that the life is in the breath. Va'ipach ba'apav nishmas chaim, that Hashem, he breathed into Adam the soul of life, so to speak. You can also imagine that it's possible to have a heart transplant, but I can't imagine ever being a situation where you can have brain transplant, which controls it's almost like brain is synonymous with a person's identity, more than the heart. Heart became much more clinical. And while the Chazal, the sages and the Talmud, they must have known that the breathing comes from the brain, not from the heart. But first of all, the tools which they gave in a Talmud was based on the knowledge at the time. So they couldn't have given any other tools of checking whether a person is alive. So even when you're talking about checking the heart, in those days, there was very little difference between that. If the breathing would stop, the heart would also stop. So I don't see much of a conflict between two opinions. I think it's more relevant maybe in our times than in those times. And certainly they didn't check the pulse in those days. And I think that many of the post-Talmudic and even the later sources, when they spoke about the definition of death and how you check for death, they, in a roundabout, even though the Maral spoke about the beating of the heart, but in essence, what they were saying is that it's dependent on the breathing, and in certain times they may not have known that the breathing is dependent on the brain. Do you agree with that? Is that something that makes sense? That it only became known when did the doctors come to the conclusion that the brain controls the breathing?
Just to strengthen your point, until the 16th century, until Harvey, the assumption of all scientists in the ancient world and medieval world, and it seems very clear that this was the assumption of Rashi and other Rishonim of this era, and even later the Chacham Tzvi, who was already of the Achronim, quotes it at length. The assumption was that what pushes the air, the breathing, is the heart. They didn't know that the heart is pushing blood. That was unknown. It sounds to us like, how could it be? It's impossible. But that was for many, many generations. And hence, what they understood was that the heart is pumping air, which comes through the nostril some way to the heart, and the function of the lungs, which we now know that is the function of breathing, the lungs are pushing the air, they thought was just as a cooling, as a radiator over the muscle of the heart, which works so hard to push the air that it gets heated, overheated, and the wings of the lungs are cooling it off. That comes very clearly from many sources. If this is the explanation, that indeed this passage in the Talmud that I quoted, that there is a difference of opinion whether you go by the heart or by the breathing, actually those who held that you go by the heart also agreed that breathing is the principal criterion. The only difference was a technical one. Where can you detect easier whether the person is still breathing? Is it by the pumping of the heart, if you can somehow detect it, or it is through the air coming from the nostril? So actually, there is no principal difference between the two opinions. Both say the same in principle. They only argue on the technique. Now that we know that the heart has nothing to do with breathing, it is a blood pusher, not an air pusher, then certainly we are remaining with the idea of respiration, which was discovered many years later, that the center for respiration lies in a certain part in the brainstem called the medulla. And if this center functions, we breathe. And if this center is destroyed, we can't breathe, and we will never breathe because the brain doesn't know how to regenerate, and that is a final situation. So understanding it in this way, then certainly the breathing principle is universal in Halacha. It's not a difference of opinion amongst the sages of the Talmud.
So
now, let me just give one short sentence about organ recruitment. How do you take out the organs even if you decided that the person is dead? In order to do this, and we are talking about vital organs such that whoever will get it will live, and if he won't get it, he'll die, which is the heart, the lung, the pancreas, the liver, these kinds of organs that without them, there is no life. So in order to get it, you have to cut open the chest in order to take out the lungs or the heart, the abdomen in order to take out the liver, the kidney, the pancreas. That is, by halachic criteria, normally a forbidden act. This is called desecrating the dead body, nivul hames, and we are not allowed to desecrate the body. And there's no way to get out these organs without desecrating the body. So how can we do it to begin with? And another question is, we are not allowed to derive benefit from the dead. For instance, we are not allowed to take an arm and sell it for some experiment and get money for it. Now, if we take out organs and we donate it to someone whose life will be saved, there's no greater benefit that you can think of, and we are deriving benefit from the dead. And there are many other such obstacles to perform the act of recruitment of the organs. The answer to this is that since we are doing it in order to save life-saving takes precedence over all commandments and restrictions. We are allowed to desecrate Shabbat to save a life. We are allowed to eat on Yom Kippur to save a life. We certainly are allowed to desecrate the dead or to derive benefit from him, and many other such minor, relatively speaking, prohibitions. So, therefore, the only question is whether one can become halachically a donor
is he alive or dead? Because killing someone, as Rabbi Ulman said, is not allowed even in order to save someone else. So as long as the donor is still alive, we are not allowed to take out his organs because that would be an act of killing him. Although we want to save life, that is not permissible, obviously. But if we are defining him as dead, then all the other prohibitions are set aside because we are saving life.
So as you said, Professor Steinberg, this whole question became relevant only a number of decades ago when they invented a respirator which allowed for the heart to continue to beat even if the person, if his brain dies. And I wanted to ask you to share with us, in the early 90s, you were communicating with Rabbi Auerbach, Rabbi Shlomo Zalman Auerbach, who's probably the most serious Halachic authority in Israel, especially when it came to questions of medicine and medical ethics. And he had a certain problem at a certain time to accept the brain stem criteria. And you've conducted a very interesting experiment. So I wanted you to share with us. I just want to preface by saying that Professor Steinberg said before that according to Halacha, we cannot desecrate a human body. You cannot obviously cause the death or hasten the death of a human being because human life is sacred. When it comes to animals, we do have a concept of kindness to animals and not causing them needless pain or harm. But at the same time, the Torah believes, and it's a little bit in conflict with some liberal opinions in our times, the Torah believes that the whole world was created for the human race, for humanity. And therefore, we are not only permitted, but we also are encouraged to use the world around us, including the world of vegetation, the animal world, for our benefit. Hence, generally speaking, we don't have so many vegetarians. You could be a vegetarian for other reasons, but not because we believe that it's inhumane to kill animals. We believe that as long as you do it in the most humane fashion possible, and as a matter of fact, the shchita, the Halachic way of slaughtering animals, is the most humane way of doing that. But we're certainly allowed to use animals for experiments. We can't torture animals. We can't, even when we use them, we have to use the least amount of pain for them. But ultimately, to do anything with them, there will be a benefit to us on any level, on a scientific experiment, a medical experiment, or halachic experiment, is something which is permitted. So with that, this introduction, I would like to ask you to share this fascinating episode with us.
Okay, it's quite complicated, both from the halachic point of view and from the medical point of view, but I'll try to encapsulate it. When I discussed with Rabbi Auerbach the question of whether brain death and respiratory death is halachically acceptable, he told me that he heard, which was true and still is true, that a pregnant woman who is diagnosed brain dead, you still can extract her fetus and the fetus will be alive. Obviously, you do it by a C-section because she either is defined dead or acts like a dead person. She won't be able to deliver normally, but by doing a cesarean section, you can take out the fetus and it will be alive. And that is true. So he said, if this is true, then there is a Talmudic rule that would go against it, and therefore we can't accept that she is defined dead. And what is it? The Talmud says that a pregnant woman that dies, her fetus always dies before her. And if it is so, how could it be that a brain-dead woman, pregnant brain-dead woman, that we define her dead, still has a vital fetus that goes against the Talmud? So the answer to it must be that she is not yet dead, and therefore the whole definition of brain death is incorrect from a halachic point of view. There was an argument between me and him back and forth. I won't go into all the details, but finally I told him that actually, what the Talmud says is true today as well. If a dying woman lies in bed without any possibility to help her, certainly in the Talmudic times, there was no respirator. So she's lying and dying. What does it mean that she's dying? That her blood pressure drops, her sugar level goes down, and the whole system is breaking down. Certainly the fetus, even nowadays in this situation, will die much before her because he's very vulnerable and he won't be able to survive this situation. Her body will take it a little longer, but he will die earlier. That is true. But as I defined earlier, brain death can be only regarded if the person is on a respirator, because otherwise, if the brain dies in a few minutes, the heart will stop and both sides will come together. Now, if we take a brain dead pregnant woman on a respirator, why should the fetus die earlier? Even if she is dead, he doesn't care what her definition is. What he cares is whether he gets oxygen, whether he gets glucose, whether the heart of the mother supplies him with what he needs. And a brain dead person on a respirator, as we said, all the organs except for the brain are functioning fine. So why should the fetus be affected at all? So the Talmud is talking about a situation without a respirator, and that would be true then, and it is true today. But when we define her as brain dead, and we call her dead, and yet we are able to deliver a live fetus, it is because she's on a respirator, and the fetus gets all the sustenance that he needs. So he said, that's very nice, but prove it to me that indeed there's such a difference. I said, how can I prove it? Makes sense. I mean, I'm a physician and I understand the logic of it. I don't know how to prove. After a few days, he called me up and said, would I come to him to continue this discussion? And he said, I was thinking about it and I designed an experiment, a medical experiment, not a halachic experiment, a medical experiment to see if you are right or not. And his suggestion was to take a pregnant sheep and decapitate her, and we'll come in a minute on how to do it. And if the fetus will survive, if this sheep will be on a respirator, then I proved my point. Why decapitate? Because he wanted to get to a situation where this mother sheep will be called dead by clear halachic criteria that no one argues with. And there is a Mishnah saying that if a person's head was decapitated, he is instantly dead, even if there are still some movements. And he told me that he witnessed in his younger days that chickens that were running around in the courtyard sometimes were decapitated and they continue to run. So you would say if they still have movements, maybe they are still alive. Says the Mishnah, he is dead right away. So if we'll decapitate the mother sheep and connect the body to a respirator, and then the fetus, the calf, will come out alive, then I prove the difference between a situation without a respirator and with a respirator. It's a long story. It's not so simple to do it. We did it. Obviously, we anesthetized the sheep, as Rabbi Ulman said, not to cause unnecessary suffering. And actually, to decapitate is the beginning of shchita anyway. So we do it routinely to sheep. We shecht her and then we use her flesh. But here we continued and we decapitated the head of the sheep. We put a respirator, a cannula of the respirator into the stem of the trachea that was left with the body. The head was somewhere else. And we continued to cause the mother sheep to breathe. And we witnessed that her heart continued to function, even though her head was somewhere else entirely. And because the heart functioned, the calf was continuing to get its supply, and there was an argument when to do the C-section. I won't go into the details. It has also to do with some halachic criteria. We did a C-section, and the calf was alive. I even visited him a year or two later, and he was fine. So that is a proof, A, that the heart is irrelevant to the definition, because no one in his right mind will call a decapitated sheep, mother sheep, that her heart is functioning normally, totally normal, that she's still alive because her heart is functioning. And B, it proved that the fetus can stay alive despite the fact that the mother is dead by acceptable criteria of halacha, that the mother sheep is dead, and therefore the fact that a pregnant woman who is diagnosed brain death can deliver a live fetus is not against the Talmudic passage that it can't happen because of the difference between with and without a respirator. That was a very interesting experiment, I think unique in the world to do a true medical experiment in order to prove a halachic question. We even published it in a notable medical scientific journal as another proof to this concept of respiratory brain death. Not everyone accepted this even after this experiment. I won't go into the further arguments, but I think it was a very strong evidence that the heart is not what counts to define death, but rather the breathing. And obviously without the head, there was no breathing. And obviously without the brain, it was irreversible.
Is the baby sheep still alive, or you have any knowledge of that? The baby sheep that was born from that.
Yeah, I don't know his status today. I mean, it was many years ago. I think the half-life of a sheep is 6-7 years, so it probably is not.
Really? Okay.
But shortly after the experiment, he was alive and he was well and he was a normal calf.
Yeah. So there are two more, we could talk about it so much, and it's a fascinating topic, but two more things I want to discuss. As Rabbi Auerbach was the authority who lived in Israel, in the United States, the greatest authority, who also the whole world looked at him for guidance, was Rabbi Moshe Feinstein, who was the author of Shuvas called Igros Moshe, and who spoke also about all areas of application of Jewish law to modern times. His position became also very political and very debated. There are, it's interesting that his family, his sons and his son-in-law, they learn out from his responsa and also from his oral directives that he did accept the concept of brain death or respiratory death, as we call it, and others vehemently object and say no, that he was the promoting the and expanding on the heart criteria. Can you, in very short, tell us about his position?
Okay, so his rulings were published in 4 different responsa in the volumes of Igros Moshe. The first one was shortly after the first heart transplant that was done by Christian Bernard in Cape Town in South Africa. And he ruled that what Christian Bernard did was a double murder. He killed the donor for taking out her, it was a female, the first one, for taking out her heart, and he killed the recipient, who by the way was a Jewish patient, because he died 18 days after the transplant. So those who go according to the position that Rabbi Feinstein's position was that you're not allowed to do it, is because he said it's a double murder. You are killing the donor by taking out the heart. So it must mean that you go by the heart. And since the heart was functioning, it was a murder. However, 3 subsequent responsa, and especially one that was published after he died, although it was written before, obviously before he died, are very clearly stating that all depends on respiration and brain, and the heart has no relevance in the definition of death. Now, it's hard for me to see how one can distort the clear position that was stated in 3 different responses, especially the last one that says that since the Harvard criteria, which are the medical criteria to establish brain death, since they include respiration as a must in the criteria, all depends on respiration, and the brain points to the irreversibility, and therefore it is acceptable as the death of the person, even if the heart is still functioning. That is written very clearly. What happened with this last responsum is that it was typewritten, and his signature was hand signature. Now, the opponents claim that this was a falsified responsum because Rabbi Feinstein didn't know how to type on a typewriter. So someone has typed it, and it was in his last half a year or so before he passed away. So those who were interested to promote brain death just typed this responsa, showed it to him, and he wasn't fully aware of what's going on already, and he signed it. That is certainly, I can say clearly, a lie, and his son, who is still alive with us, of David Feinstein, clearly stated that it's not a falsified responsum. We also know the physician who asked this question and got the response, who certainly testified that it was all clear, and if you nullify this responsum, there were dozens of responses still in these years of Rabbi Feinstein, so you have to say that all are falsified, and obviously no one can claim such a thing. I think it's a Chilul Hashem even to talk like this, and therefore that is very clear. So his position, I think, is very clear that if there is an irreversible cessation of respiration based on irreversible damage to the brain, this person is dead even though his heart is functioning. But now what do we do with his first responsum where it seems like he said it's a double murder? If you read carefully this responsum, he says, and that is what he was told apparently, that Christian Bernard took out the heart of this female donor before she stopped breathing. She was hit very badly in a car accident. She had a severe head trauma, and he regarded her as dead. In those days, there were no clear criteria. The Harvard criteria were formulated only a year after his first transplant. So he just decided on his own that she was brain dead, but apparently she was still breathing, and he took out the heart. That, says Rabbi Feinstein, this is murder, because as long as she's still breathing, even though she will die, she's not yet dead. And as Rabbi Ulman said, you're not allowed to hasten death even by a moment, even in order to save a life. And so apparently Christian Bernard killed her by taking out her heart before she stopped breathing. But in the circumstances of the Harvard criteria and what we do all over since Christian Bernard, there is a cessation of breathing, and it's irreversible, and that's the sole criterion for death. Incidentally, I visited Cape Town, and I was privileged to hear firsthand what really happened in this first transplant. The people there in Cape Town turned the hospital where this first heart transplant was performed into a museum. It's an old building, and they didn't use it anymore as a hospital, so they turned it into a museum and very carefully documented every minute from the time that this young lady, excuse me, this young lady came to the trauma center, was intubated, and until they finished the whole transplant, and the person who was transplanted passed away after 18 days. And I was privileged to get the guide for this tour by a woman who was a nurse at the operation, at the actual operation of Christian Bernard. She was on the side of the recipient, but she was part of the whole process from the time the trauma patient came in. And she told me that these rumors are absolutely wrong. Not only was he careful not to take out the heart while she was still breathing, but what he actually did, he took her down to the operating room, and there were two adjacent rooms, and one was Mr. Vashkansky, that was the name of the recipient, waiting to open his chest, take out his sick heart, and in the other room was this lady waiting for her to be brain dead and take out her heart and bring it to the other room for transplant. So what he did was he took this lady down to the operating room, disconnected her from the respirator, and waited not only until she stopped breathing, but until actually her heart stopped. And then he did a CPR, revived the heart, opened her chest, took out the heart, and transplanted it to the recipient. So the rumors that Moshe Feinstein got that this person was still breathing, she said was absolutely wrong. Not only wasn't he breathing, his heart stopped. But what she didn't realize was that that was even a worse act than assuming that the woman was breathing, because that was an actual killing. By withdrawing the respirator, he caused her to die. And that certainly is unacceptable by halachic criteria. So that would be another reason that if Rabbi Feinstein would have heard that, he would have said that was wrong from this point of view. But anyway, something was wrong in this process of the first heart transplant. That's why Rabbi Feinstein ruled that it's a double murder. Incidentally, he said then that it is also a murder of the recipient. But we know clearly that after cyclosporin A was introduced and most transplanted people died because of rejection, and once this medication came to be a routine treatment, people with receiving heart transplant live for many, many years. So Rabbi Feinstein himself allowed to become a recipient. So you can't say that he allowed someone to be killed if you go by the first responsum. So it's clear that the first responsum had to do with exactly what he was told happened in Cape Town. But that is not a position when facts have changed. And the facts have changed on both sides. The recipients live longer, and therefore it's not killing of the recipient, and the donors are dead by respiratory criteria. They're not breathing and irreversibly, and therefore, according to his opinion, they are also dead, and therefore there's no killing in this process.
Was the anti-rejection medicine available already for that operation?
No. That operation took place in 1967, and cyclosporin A was introduced in 1980. So how did they imagine that a patient will survive with a foreign heart? They treated them with high-dose steroids and with anti-cancer medications, which these medications killed this Vashkansky, for instance. So he died because of the treatment not to reject it. So they couldn't really go ahead with it, and there were very few successful transplants because not of the technique. The technique was good. As they say, the physician succeeded, but the patient died. So that didn't work. But once it became available after 1980, people today are living long lives.
But maybe that's why Moshe said it was a double murder, because the recipient had no chance.
Right, exactly. Until after 1980, no one recommended halachically to someone to become a recipient because they didn't have chances.
So about, I would say by now, 6 years ago, Professor Steinberg came as our guest to Australia to help us establish a a protocol here for halachic egg to become a halachic donor. And one of the principles that we worked on was to have an independent system where we have where we supervise somebody not from the medical staff. I suppose even though the way Australian law mandates the process of donations, they also take into account conflict of interest. So they also have a system where they have to have a separate department that actually certifies death of the donor in order to be able to take away his heart and his liver and so on and so forth. But we went with the principle in everything that we do, whether in fertility, whether in genetics, we always have a supervision mitam from the responsible to the rabbinate, either ourselves or somebody responsible to us. And we use the same protocol that you've established, and I believe it was legislated in Israel, if I'm correct, to be able to allow for these donations to take place. So before I'll ask you to go over some of the clinical and conformatory tests that we require, some of them are required anyway, and some of them we asked over and above what they have here in Australian law. I want to say that the benefit of establishing the system was much, much more encompassing than just to allow Jews to become donors. First of all, in the idea itself, it's what we called a Kiddush Hashem, sanctifying Hashem's name, because until now the perception was that a Jew can only be a recipient. You're allowed to receive somebody else's tissue and limbs and organs, but you cannot be a donor. You can't give, and that is not very complimentary to us. It shows that you're allowed to. You don't mind if somebody else is killed in order for you to receive it, but you can't do it yourself if we believe it's killing. So the idea itself that the perception is changing, and both from the Jewish world and non-Jewish world, they can see that a Jew, as long as it's done without compromising the halachic standards, a Jew could be a donor. It also allowed us, because of the meetings we had with ICUs and hospices and so on, with the staff from different hospitals, to introduce our halachic criteria into the questions of end-of-life issues, which we spoke about last week. In other words, here in hospices, for example, it's a standard procedure that they deprive a terminally ill patient of hydration, of nutrition. They take them off respirators when they're still alive. And we trying, it's a process, we're trying to make both our community and the medical community aware of our needs. And there was a lot of progress made in this area. Some of it I shared with you last week, in last week's lecture. But the only case so far we had of a halachically sanctioned organ donor was last year when we supervised a dying patient in Melbourne. And this was something which made papers because it was the first case which actually was officially under the halachic supervision and under the sanctioning of halacha and the Beis Din. And it also sounds something which became very created in Kiddush Hashem. However, what I want to say is that when we do allow here in Sydney for a person to write, to have a special card, there's an organization called HUDs which created special cards that people show the will to be donors. We always make them write a clause that it's under the supervision of the Sydney Beth Din, to make sure that it's not just done under the principles, medical principles which are established, but actually under supervision. So can I ask you, Professor Steinberg, just to, in very short, to describe what are the general tests applied to determine that the potential donor is indeed, or anybody, it applies to any person that will be pronounced dead according to halacha, at least according to the brain criteria or the breathing criteria of halacha. Obviously, the same criteria would apply to whether or not you can take his organs. So can you just tell us in short the few clinical tests and some of the conformity tests which are used over and above the clinical ones.
Right. So what we want to do is to verify beyond any doubt that the entire brain is totally destroyed or damaged, and it's irreversible in its status, so that the brain death is really a total brain death. That can be done, and that is universally accepted since the Harvard criteria, as I mentioned, from 1968. That can be done by clinical testings. And it will be, I guess, too complicated to go into the details, but there are several levels of brain function that we are testing clinically by doing the test by the physician on the person's body, verifying that the brain, including the cortex, the higher level brain, and especially the brain stem, are dead and not functioning. Many of those clinical testings are such that you can't fake. In other words, no one can make himself brain dead and show the signs, that we are looking for, because that's a reflex that no one has a control over it, and either it's there or it's not, and therefore they are very reliable to say that the brainstem is dead. So we look on functions of the cortex, we look on functions of the brainstem, and the most important test, which again is uniformly acceptable, and that's what made Rabbi Feinstein finally to allow this concept, is what's called an apnea test, because as you remember, this person that we are determining whether he's brain dead or not is on a respirator. How do we know that he's not breathing? Because the respirator is functioning. In order to know that he's not breathing, we have to disconnect him from the respirator and see if he can breathe on his own. But as we said, disconnecting such a sick person from a respirator may by itself hasten death. So it will be a fulfilling prophecy rather than testing the situation. So that is a very delicate and complicated test to do, but we know how to do it very well without compromising the life of this person. Obviously, it's done only for a short period of time. We do it in the most extreme circumstances, and if we see that the person is not breathing on his own without a respirator under such extreme circumstances, then we are sure that the major sign from a halachic point of view, but an important sign from the general brainstem concept, is that he is not breathing. And since we know that the brainstem is dead by the other testings, clinical testings that we did, then we can be sure that the person is brain dead. This, however, is not sufficient from at least the chief rabbinate's position in Israel, because A, there may be mistakes, and B, maybe, although we never encountered it, but theoretically, maybe some physicians say, what do we care if he's really brain dead or not? He's already on the verge to be dead. It is not important a few minutes or hours, and let's pronounce him brain dead so that we can do the organ transplant at a convenient time. There was a fear, and in the public, this fear is well known, not only in Israel. I heard it in England, I heard it in the United States. There is a mistrust, a certain mistrust to physicians, and because they are inside the room and they're doing clinical testing that you can't check, so how do you know that indeed all these tests were negative, that you can say for sure that this person is dead, brain dead? And even though they are negative, how do you know that it's really irreversible? Therefore, the chief rabbinate required that an objective test will be done that will show either that the brain cells don't function at all by a machine that shows that they are not functioning, or that there is no blood flow to the brain at all, and that certainly verifies that if blood doesn't come to the brain can't exist. And there are various such tests that can be applied, which are objective and which have a printout, and you can show it to any expert and they'll tell you, is there still function or isn't there function? So this is something that you can verify, A, that there's no mistake, and B, that someone didn't cut corners. That was not accepted in most countries in the world. Some did, but most not. And there were other conditions that the chief rabbinate required. For instance, that the family should have the right to go to a rabbi or to another physician that they trust, and everything has to be open to them, and they should see if indeed everything was done correctly, and other such things. That was legislated in Israel, that in order to pronounce brain death, you have to do not only the clinical testings, but also the verifying instrumental tests and the critic of someone that the family chooses. That was not accepted in most countries, including in Australia as a normative way. But Rabbi Ulman and the Beis Din convinced the authorities in Australia, or at least in Sydney, that if it is a Jewish donor who is willing to accept brain death and who is willing to donate organs, but he would do it only under the strict criteria of Israel, which is now not only the chief rabbinate's position, but actually the law in Israel, then they will, quote unquote, gain organs even from such a person, but that has to be done according to this protocol and with the supervision of the rabbi or the Beis Din. And indeed, I helped to formulate the protocol, the medical, it is a little bit complicated, but we formulated it, it was accepted, and as Rabbi Ulman said, it was even implemented a year ago in one case. Obviously, in Australia, the chances that a halachically observing Jew will be brain dead and will accept to become an organ donor happens not very frequently. In Israel, it happens all the time. And that's how we are doing it in Israel for those who accept the principle of brain death, but want to do it strictly according to the chief rabbinate's directives, and which became the law of the land.
So before we ask a few questions that came up on the screen from the participants, to sum up the Sydney protocol which we have, is that anyone that wants to become a potential donor, we hope that it's not going to happen and everybody will have a long and healthy life, but just in case of an accident, people asking if they could put in a living will that they want to be a donor, it halachically has to state that has to be done under the supervision of the Sydney Beis Din, and then we'll get a call and make sure that it happens under the same protocol which Professor Steinberg helped to legislate in Israel under the Chief Rabbinate of Israel. So the first two questions are very similar. The question, does it even have to be donated to a Jew? I doubt even in Israel it can be guaranteed, or is a Jew only allowed to donate if it's going to a Jew? And is a Jew only allowed to receive from a Jew? When it comes to the question of being an organ donor, we're not discussing over here killing anybody, we're discussing only a question of desecrating the body. Over here, no difference is made by either way. We both from the Australian law, and I'm sure it's the same thing in America and everywhere, when it comes to donating a kidney, you can choose that you want to donate it to a friend, to a family member. When it comes to any donations that are associated with after one's passing, it has to go to the next person, and both Halacha and Australian law doesn't differentiate, and that's our position also when it comes to being a donor, that it goes to the next available person. Next question is, how should a physician that is Jewish in a secular hospital act if he or she needs to discuss organ donation with patients? So I'll leave it to Professor Steinberg.
Well, so if he thinks personally that brain death is acceptable and that can save so many lives, So obviously he's obligated to try to explain it to the family or to the patient itself and direct him to do it in the right way as we just discussed. If he's of the opinion that it is forbidden, because as long as the heart is functioning, it is shortening life, then he has, in every country, I think by now, the right to abstain from taking care of this patient. As similarly, if someone in a country who was withdrawing a respirator from a dying patient is permissible, but if he thinks that that is a form of killing the person, he shouldn't be the one to do it. He should abstain, and someone else who agrees with it should do it. And same holds true for abortion. If someone feels that abortion in a certain circumstance is forbidden, he or she should not be the one that should perform the abortion, and that is a conscientious abstaining, and that should be respected by every husband.
Thank you. The next question is that sometimes, something which we discussed last week, but I think I'd like Professor Steinberg to answer it. Sometimes breathing is impossible for life, irreversibly. We have many paralyzed people living this way in a permanent respirator outside of the hospital. Does it change the definition of death?
Well, that's a classic question. It happened in the old days when polio victims were under an iron lung and they were not able to breathe, but they were alive. If we say now that irreversible cessation of breathing is the dominant, the determinant sign of death, how can we call this person alive, or is he really dead? And the answer is very simple. He acts like a live person. He can talk, he is conscious, he has feelings, his lungs are defective, and therefore he can't breathe. But his brain and his brainstem is still functioning in other ways that can promote other signs of life. And therefore, in this passage in the Talmud that I mentioned about the collapsed building, Rashi there has a very interesting comment, and he says, when do we look whether the nostrils are putting out air or the heart is functioning one way or the other, as we explained earlier, it starts only when he appears to be dead. In other words, if he looks alive, you don't check for these signs to see if they are there or not. Obviously, he's alive, so he may have a disease that is causing him a misfunctioning of one or another function. But if he appears to be dead, he looks like he's dead, he acts like a dead, I mean, he doesn't act at all, obviously, and the physician assesses that he's dead, but you want to know if indeed he is dead, then you look for these signs. So obviously someone who is under a respirator, but he is fully alive and conscious, we don't ask what the respiratory status is. That is irrelevant.
Thank you. Next question. As I understand, there is a difference between medical brain death and halachic brain death. If this is indeed the case, then how can we determine halachic brain death in order to enable a major organ transplant? I understand that they have devices to test for this in Israel, but that they are limited in the Chutz La'aretz, outside of Israel.
No, I think there's a misunderstanding. These technologies are available all over the world. They are just not used for this purpose. I'll give you an example. There is a test called a SPECT, which is you inject a certain radionucleic material into the vein. It goes into the body, including the brain, and then there is a camera that checks the radioactivity that comes out. If the cells of the brain are totally destroyed, there will be no uptake of this material because they are dead, they don't absorb it. And then it will look in technical terms as an empty brain, empty head. It looks like there's no brain there. That technology is available all over. Nuclear medicine is a division in every hospital. You do it for many other purposes. It's just not applied as an addition to the clinical criteria of brain death. What we require is apply it and make sure that indeed, objectively, no cell in the brain is uptaking this material, that is something available. The same is true for all kinds of testings, whether there's blood flow to the brain. All these machineries, whether it's an MRI or a CT or a transcranial Doppler, all these are available in most hospitals. And they can be used if you want to use. And that is what exactly happened in Sydney, that Ulman, myself, convinced the authorities to use it, not to invent it or import it from Israel. That's available everywhere. You just have to use it.
So, there's sound coming up from somewhere. I don't know where it's coming from. So next, I'll read the next two questions because perhaps they could be combined into one. Well, actually, let's separate them. The next question is a general one. Should one sign on a halachic organ donor card? In other words, we've established if a person wants to be a donor and he's happy to accept the criteria which the Beis Din has endorsed of the brain stem or the brain death criteria, which is an irreversible cessation of any respiratory function. So the question is now not whether the person can do it, whether the person should do it. So I'd like to hear Professor Steinberg's opinion, how he would answer this question.
Well, I think that if indeed the person accepts the principle that brain death is the moment of death, halachically speaking, and if indeed all the verifications from a medical point of view, all the standards that we enumerated are in place and are would be actually implemented, then I think that it is a form of an obligation to agree to be an organ donor, because this is clearly, and everyone agrees, even those who disagree with the concept of brain death, agree that donating organs is saving lives, and saving life is the highest call that we have in Jewish law, in Judaism at all. So if you can save lives of others, obviously you're obligated to do it. The hindrance is that perhaps you're not allowed to do this act because it has to do with other problems, such as if the heart is still functioning and you go by the heart, you can't kill the person in order to save someone else. But if you accept that he's dead, why should his organs go, quote unquote, to waste when they can save lives? Now, I'm hesitant to say it's a mitzvah because the dead is already not obligated in any mitzvah. So you can't call it a mitzvah in the regular sense. But as long as I am alive and I know after my death, it can be possible that I might save lives after my death. I think that should be an obligation upon everyone who accepts brain death and knows that it will be done correctly from a halachic point of view. He should sign a donor card, a halachic donor card, know who the supervisor is, and then save lives.
And this is really the answer for the next question. Next question is, doesn't a yid need to be buried with all his limbs? If so, how could one donate an organ? So again, the main argument about organ donations was to do with the fact when is the person dead according to Halacha, according to Jewish law? Because there's any question whether he's alive or not, then there is a much larger problem that's of murdering somebody. Because even if you murder a 120-year-old person in order to save a 5-year-old person, that's considered murder. So if we establish a situation where halachically we know a person is dead and you can save somebody else, then as much as the mitzvah of nivul mes and the isur, the prohibition of desecrating a dead body, is a very important obligation and very severe transgression. And we're certainly forbidden, we'll discuss at one stage about why we're forbidden to cremate bodies, why there's so many laws concerning proper burial and a quick burial So much so that even at one point in a few hundred years ago, there was in some countries that wanted to wait for 3 days to bury somebody because they were afraid that maybe they're alive. And the halachists have said that if you follow the halachic criteria and you make sure that a person is dead according to halacha, then you don't have to worry. You have to bury a person immediately without waiting an extra day. So all this is true if it's only talking about the dignity and the sanctity of a body, which is true. But if you're able to save a life, then certainly saving a life comes before that. That was the next question. The next question is directed to me, which we'll talk about soon, maybe the next one. This is a very interesting question. But this question is actually asked by a member of our community who's a paramedic. He works for ambulances. And he asked, at what point would you cease doing CPR in a cardiac arrest, in a traumatic cardiac arrest, and non-traumatic cardiac arrest? That's the question.
Again, I didn't
At what point would you cease doing CPR in both traumatic cardiac arrest and non-traumatic cardiac arrest?
Well, so there are criteria established already a long time ago by the Cardiology Society and by trauma centers that you give it a chance. Some say 20 minutes, some say even 15 minutes, some may extend it a little more, but there is a limit of time, around 20 minutes of efforts to revive the person. If you did the best CPR that you know how to do, and after 20 minutes there's no response, then you can pronounce that the person is dead, and this is dead by all criteria, because now he is cardiac dead, and obviously if the heart stops, the brain stops, and there's no respiration, so it's still the old definition of cardiorespiratory death. If you feel that there is some response and you want to do a little more effort, that is okay. But usually, if 20 minutes of intensive CPR does not bring back the function of the heart, you can stop at that point.
Any more questions? Yeah. A couple more. Okay, the criteria to determine irreversible damage to the brainstem we discussed already. We spoke about it at length. Now, how can you ensure that the organ donated outside of Israel will be used to help a Jew? Is there protocol in place before donating organs? So we explained before that not only it's impossible, but actually our criteria doesn't demand that, and you can use the organs to save any life. Is a Jew, all right, we've done the next ones. We've done. What happens with Tchias HaMesim if you donated a vital organ? So we know that ultimately there are discussions in many of the sources that burning the body, for example, can impact on Tchias HaMesim. At the same time, we know that any Holocaust victim who was burned in a gas chamber, nobody would think. On the contrary, it says that Tzaddikim and Kedoshim will come before anybody else. Nobody would suggest that because they were burnt al Kiddush Hashem, therefore they will be denied Tchias HaMesim. And if there is any reference to, and there's also talking about a certain bone called luz, that apparently from there it never disintegrates, and from there the body is, so to speak, comes back to life. But ultimately, nobody suggests that it's carved in stone, that if a person doesn't have all his body intact, he won't be resurrected. There are certain possible repercussions if a person knowing the law and knowing that he's doing something wrong, and nevertheless he destroys and creates the body. But a person that either unknowingly does it, or he's doing it in order to be able to save another person, there's no question. He will not only he won't be penalized for it, he'll be rewarded for saving a life. Like it says, anybody who saves a life as if he sort of upkept the whole world. Okay, we answered the question, COVID-19 already. how would a person be able to be an organ donor according to halacha in America? No difference between America. I think I understand the question. The question that is asked that in Sydney or in Eretz Yisrael, we have a protocol where it's supervised. In America, it's not supervised for a number of reasons. First of all, the RCA, for whatever reason, took a very strong approach for the heart criteria. I understand. Am I correct, Professor Steinberg?
Well, there were times where they were for brain death, there were times where they were for heart. I think the latest now is in between. They're not decisive, and you can ask whoever you want. You are free to ask.
But certainly, I think the question is a fair question, because in America right now, there's no system. America is a Wild West, and there's no systems for most things. It's not a very organized rabbinically. There's a lot of rabbinic services and a lot of great rabbis and a lot of Orthodox life, which is flourishing and learning and everything else. But as far as organized life, it's lacking what they have, for example, in England or in South Africa or in Sydney or in Eretz Yisrael. So I'm not sure what the answer is. If there is any type of a system which could ensure, I would say from my perspective that until that system exists, one should not be a donor, in my opinion. There has to be something organized, not just relying on the medical system. But let's hear Professor Steinberg's opinion.
Yeah, to the best of my knowledge, the Hod Society, this is the Halachic Organ Donor Society, they do provide assistance in specific cases, in specific locations, that it should be done even according to the Israeli and now Sydney protocols. So I think if someone feels strongly that he accepts brain death in America and he wants to do it according to our criteria, I think he should be in touch with the Hod Society and see what they can do.
You can be in touch with me. I know the director very well. He's in touch with me all the time. So I can talk to him about, and if somebody wants specifically to ensure that they're only prepared to sign up as a potential donor if there'll be a very, very good supervision under the same criteria and the same standards as in Eretz Yisrael, then I would say that then it's okay. Next one. Is there a specific halachic organ donor card that a person can carry with him or her? It is certainly registered like for the secular organ donor IDs. Again, it's I will answer because I know that where the person is asking the question from. The cards themselves, in my opinion, they're more symbolic than legal. I think if anybody wants to be a donor, there has to be a living will which will specify exactly what he wants. The card could be beneficial if somebody is in a situation where they just find a card in his wallet. But it certainly can only be carried and used in a place where this could be implemented. So if, for example, you're talking about in a place like China at the moment, then it's out of the question because there's no system at all over there. So I would say that you can have a card with a specification or living will specifying which rabbinic body will ensure that everything is done under halacha, but it's only limited to places that have that particular system in place. In Melbourne, they're going with Sydney at the moment. And they actually asked me to be involved. Because of COVID, everything stopped. But there was actually the Rabbinical Council of Melbourne have requested me to work with this organization, the government organization, to train rabbis and to talk about the halachic aspects. So it's in the makings of Melbourne, but COVID put it on hold. And at the moment, they are calling us for any advice. The Melbourne Beth then at the moment, I think they took the position of the heart criteria. So they don't want to be involved in that. So the rabbinate is coming to us for specifics. Okay, this is a question for Professor Steinberg because we're talking about globally. How has COVID-19 affected organ donation?
To the best of my knowledge, it didn't affect. I mean, in Israel, for instance, I heard that there is less organ donations because there are less car accidents because people are closed at home. So practically speaking, there are no candidates for it. But Otherwise, it's the same as other. The COVID doesn't affect the organs.
The next question is, does organ donation in Australia affect a delay in burial? Jewish law demands immediate burial. Again, the immediate burial is important because it's also nivul ames and kovod ames, and there is even a negative prohibition of alonos ames, which means to delay extra day the burial of the body. However, nevertheless, if it can save a life, the respect to the dead doesn't overweigh saving a life. So if a life can be saved, it justifies delaying it a bit. And the Kohen is not different to anybody else. A Kohen can donate the organ as, again, we're talking about, we know that a Kohen, when he's alive, there's a question of duchening and everything else, but that's already a different question. If a Kohen will talk to somebody, if it will affect Avat Chiyas HaMeisim, it will affect his Avodah in Beis HaMikdash, and so on and so forth. That's something which we have to think about. It's an interesting question. But I want to say that it was a real honor to have you, Professor Steinberg, with us. Unfortunately, we could talk about it a lot, but we promised over here people time restriction, and we have to, unfortunately, finish this session. But I hope we'll have other opportunities. And may Hashem bless you to continue all the work that you're doing. Professor Steinberg is involved internationally he's the address of anything that's associated with those subjects. And he travels extensively. I mean, until COVID, he travels to different countries to symposiums and conferences and so on and so forth, and to assist in these sort of things. And at the same time, he juggles publishing the largest, Talmudic encyclopedia, which under his leadership, before they used to have like one volume every few years. Now he has and every year many volumes come out. So it says when something has to be done, you have to give it to a busy person. So Hashem give you the koyach to continue and to achieve all the things that you're doing, and also with all the personal blessings for you and your family, and where we continue our friendship and our work together for many, many years to come. Thank you very much.
Amen. Thank you very much for having me, and keep safe and healthy, all of you. It's really trying times, and we have to do the best to protect ourselves and others. And this way of the Zoom is really a good invention for these days, and maybe even for normal days. Who knows? Thank you very much.